focusing most of your time and your energy and the resources of your department in terms of those top issues?
We have, from the Public Health Agency of Canada perspective, made family violence and child abuse one of our top public policy priorities. That's Sheldon Kennedy. We've worked very closely with Sheldon and other organizations, but it's my belief that we need to intervene early in these issues, whether it's domestic violence or children either experiencing violence or even seeing violence or being victims of child abuse. We know that that leads to mental health issues, suicide. We know it leads to incarceration. It leads to high-risk behaviors. So this is an area in which I think if we can intervene early, we can make a huge difference in not only the lives of those young people and future adults, but we can actually have a huge impact on the cost of taking care of these kids as they grow older. So we've made that a priority. And last week, actually, Sheldon and I announced a $100 million program towards family violence and child abuse. So we'll be doing lots of good research and lots of programming to make sure that we can do evidence-based work to help these young people.
Excellent, excellent. Congratulations to both you and Sheldon for that wonderful initiative. So one issue I wanted to touch on, of course, in certain areas of our country, our system performs extremely well. The accessibility of care is top-notch. In others, more remote and rural areas of our country, some areas of our population don't have access to the care that they need. I'm just curious what sort of initiatives your department's looking at in order to ensure that all Canadians have access to the care that they need.
Well, it's because of the magnitude of the geography in Canada, we're always going to struggle with these issues. In very small hamlets in Nunavut, we're not going to have the same care as if you live in downtown Toronto. But new technologies are helping with that, like telehealth. Amazing opportunities for patients in a small hamlet like that to actually see a specialist in downtown Toronto over the internet. And we see more and more of that happening, which is fantastic. So technology is making a difference. And capacity building is making a difference. We do a lot of funding on First Nations and with the Inuit to actually build their own health capacity, train Inuit and First Nations professionals to become nurses and doctors. So lots of work to be done. We're always going to struggle a bit with that because of the size of Canada, but technology is making a big difference.